Yeah, hi Dipti. Thank you so much, and congratulations to you, whole AIS team. I think this is a very good session that has come up, and I'm sure it is not to scare all the people who are seeing it or who are beginners. It's basically to know how these rare complication can be managed, and once you have listened to it, there is a possibility when you'll have it, you'll be able to manage it. So one of those rare complication that I'm going to present here. So. Around I think 7 8 years back, so one of very eminent refractive surgeon, very senior and a very good friend also, he called me up. He said, because I'm sending you a post LASIK boy, and for which you might need to do a bilateral keratoplasty. So I was shocked that bilateral keratoplasty, what happened? So because this was the patient. So what actually had happened was, this was a 26-year-old male who had undergone LASIK for -4 diopter in both eyes 3 weeks ahead of his marriage. And on first postoperative day, as per the referring doctor, said that his vision was very good. And it was on day 3 when he started developing dimness of vision, watering, pain, and edema of lids. They had started him on natamycin, vancomycin, moxifloxacin, but it was referred in next 2 days, and after 2 days it was referred to us. That means on day 5 of LASIK was when I saw him first. When we saw him, he was very depressed, tense. He was not at all furious. He didn't want to sue the doctor. He basically wanted to get rid of this problem, within 3 weeks. So he had county figure close to face in both eyes. And when we saw it, it was infiltrated. The whole flap were infiltrated. There was interface infiltrates, and he was taken up in OR. And the plan was to flap lift and do a scrapings both from the bed as well as under surface. But when we saw, after lifting the flap, the whole flap was infiltrated. And as now discussed in many other previous presentations also, we amputated the whole flap because it was heavily infiltrated, and took the scrapings from bed as well as on the undersurface of amputated flap, and that too in the both of the eyes. So it came out to be filamentous fungus, both on Kirch Mount and Gram stain. He was started on combination therapy of topical voriconazole and natamycin and hometopin. And after 4 5 days, we had growth also. It was aspergillus and the same microorganism in both the eyes. And this was 24 hours after the flap amputation and topical medication. You can see that infiltrated flap has gone. So now the drug can penetrate well. And this was after 6 weeks. The whole cornea was looking quiet. There was some cellular reaction. Most of it, there was a beginning of scar. Vision was 20/40 in one eye, 20/60 in other eye. And this was after 3 months. Within 3 months, he could get this infection, get rid of. He could get married also to the same girl. And after 6 months, the vision was 20/20 in right eye and 20/40 in left eye. So this is actually a very rare nightmare. And I'll just show you a compilation of our study that we had done on 8 eyes. These were referred to us over a period of, I think, nine years or so. These were those 8 cases who had post LASIK infections. And the important thing here is, there was all were on steroids, of course, and there was no history of trauma. Means the infection, suppose, looks like that was during the surgery. And LASIK infection duration, these all were fungal cases. So we had compiled only fungal, post LASIK fungal infections. You can see the onset of infection was within 7 days. And the infection, fortunately, all were referred within 7 days, on the duration between the onset and the referral. And one patient was referred after 28 days. All underwent flap lift, scraping, and interface wash of voriconazole. Apart from, except 3 eyes, I think we had organism also. All we could achieve resolution of infection in all these cases. And the duration was between 2 to 15 weeks it took for the whole resolution of whole infection, decent enough final BCVA. I think the catch here is why we could get good results, were the referral was pretty early. So that's why you could actually go ahead, get aggressive, and get the organism done. So we tried to find out what was the source of infection. So these were 7 different LASIK centers, 7 different surgeons, and 5 of them were very experienced. there was no cluster, so everybody said that these was, one case. We had 4 5 cases, there was only one case that had infection, and there was a routine aseptic precautions. So everybody said that they are saying it for the first time in their lives and it has never happened. So maybe patient on flora. There were, I think, four of them. They were using blades which were reusable. It's not that one blade was used for 2 eyes, sometimes they use for 4 eyes as well. So we actually couldn't find out, it couldn't point out what could have been the cause, but that's how it was. And fortunately it were saved. Thanks so much, and I think it's open for discussion.
True nightmare, wonderfully managed, Dr. Vikas. Only one thing, did you look for the ROPLAS or ask the surgeons if they're checked for that? I think bilateral, that is one.
Yeah, so in our when we saw it, there was Roplas was negative in all these cases, and but Roplas, seeing Roplas on a